The Manitoba Nurses Union isn't mincing words on healthcare.
It is in crisis.
The union has released a 34-page report with data on private nursing hours, public nursing overtime, and vacancy rates trending upward from 2020 to 2024.
I can tell you one of the most heard comments I get from nurses on the front line are, when are they going to start fixing healthcare, because we've seen no appreciable changes.
This ER nurse who works at Health Sciences Centre in Winnipeg says most days are morally grating. CBC News is not identifying her over concerns she might lose her job for speaking out.
It's just the craziness of everything that's going on. It's hard to describe. I actually would like our Premier to come, or our Minister of Health, just to come and see.
We know that the changes that Manitobans want to see, that nurses want to see, the big changes are going to take time.
Last week, they announced the province had hired 481 net new nurses to the public healthcare system since April last year.
I had messages from members asking me, where are they?
Union President Darlene Jackson accuses the NDP government of falling short on collaboration and transparency.
I can say it's very comparable with what we saw with the previous government.
Health Minister Uzoma Asaguera disagrees, saying they've been listening to frontline healthcare workers since day one in office.
Our government's approach is completely different than the previous PC government.
From Washington, D.C., Premier Wab Kinew encouraged unions to be positive while pointing to his government's new hires in healthcare.
They're getting a great wage. They're getting more work-life balance. Everything that the unions have been asking for, we're delivering on.
The Nurses Union highlighted a number of recommendations in its report, including improving Manitoba's travel nurse team and sharing more information. The health minister did not commit to any of the 6 recommendations, but said they're making progress. Rosanna Hempel, CBC News, Winnipeg.